So, what is an STI? You might have heard the term before, but let's break it down together. STI stands for sexually transmitted infection, and it's a term used to describe infections that are most often spread through sexual contact. This includes vaginal, anal, or oral sex, and it can affect anyone, regardless of age, gender, or sexual orientation. Simply put, an STI is an infection that passes from one person to another during intimate contact. It doesn't matter if you're in a long-term relationship, dating, or exploring your sexuality, STIs can impact anyone who is sexually active. It's important to remember that these infections don't discriminate, and being informed is the best way to protect yourself and your partners. STIs are caused by different types of germs, bacteria, viruses, or parasites. Each type can affect your body in unique ways, sometimes causing symptoms, and sometimes not. Bacterial STIs like chlamydia and gonorrhea are usually curable with antibiotics if caught early. Viral STIs such as herpes, HIV, and HPV can be managed with medication, but they often stay in your body for life. Parasitic STIs like trichomoniasis are also treatable but can go unnoticed without testing. Some, like chlamydia and gonorrhea, are bacterial and usually curable with antibiotics. That's why regular checkups and early treatment are so important. Many people don't realize they have an STI until they get tested. Others, like herpes and HIV, are viral and can be managed but not cured. With the right care, people with these infections can live long, healthy lives, but ongoing treatment and monitoring are essential. It's also important to know that some STIs, if left untreated, can lead to serious health problems, including infertility, chronic pain, or increased risk of other infections. Early diagnosis is key. Symptoms aren't always obvious, and you can transmit an STI even if you feel fine. Many STIs are silent, meaning you might not notice any changes in your body. That's why regular testing is so important, especially if you have new or multiple partners. That's why the term STI is used more than STD, because you can have an infection without obvious disease. Infection means the germ is in your body but you might not feel sick. Disease means the infection is causing symptoms or health problems. Using the term STI helps reduce stigma and encourages people to get tested, even if they feel healthy. Anyone who is sexually active can get an STI. It's about biology, not morality. STIs are a normal part of human health, and there's no shame in talking about them or seeking help. The more we understand, the better we can protect ourselves and each other. Open dialogue, regular testing, and protection, like using condoms or dental dams, are essential steps in staying healthy. Talking honestly with partners and healthcare providers can make a big difference. Health is universal. Being informed is the first step. When we educate ourselves and support each other, we create safer, healthier communities for everyone. Let's move forward with clarity, not shame. Remember, knowledge is power, and taking care of your sexual health is a sign of strength and self-respect.